Hi, I'm Natasha Tracy for Breaking Bipolar here at HealthyPlace.com. In May, the Diagnostic and Statistical Manual of Mental Disorders, we just call it the DSM, is being released with a new major revision. It's being called the DSM-5. And there's been a lot of discussion about the DSM-5, and many consider it to be controversial. And what I normally hear in terms of feedback on the DSM is negative. People don't tend to actually praise the people who have worked on the DSM. And my question to all these people who are being really negative is, what the heck is your better idea? So, for example, you have the bereavement exclusion. So, in the DSM-4, there was an acknowledgement that after a death, you may be obviously bereaving that death, and that bereavement could mimic the symptoms of depression. So because of that, if you were within 2 months of a death, you wouldn't be diagnosed with depression. And this bereavement exclusion has been removed in the DSM-5. Now, at first glance, this does seem to be negative. After all, we all understand that grief is a normal part of the human emotion spectrum. However, there is a reason that the bereavement exclusion was removed. And that's because grief specialists say that it can take between 1 to 2 years to grieve a person who is close to you. So the question is, if we acknowledge that grief takes between 1 to 2 years, and psychiatry is acknowledging that in this new DSM, then how do we reflect that in the diagnosis of depression? Do we simply not diagnose people with depression if it's within 1 to 2 years of a personal loss? That doesn't seem reasonable at all. 2 months wasn't reasonable either, because it discounts the fact that many people are going to grieve for a much longer period of time. So the question is, what's the better idea? If you think that the bereavement exclusion shouldn't be removed, how do we acknowledge the fact that grief can occur for 1 to 2 years and yet still have a diagnostic guideline that talks about when to diagnose depression? So I don't have a clear answer to that, but what I will say is that there's no clear cutoff date, and that doctors, psychiatrists, need to use their best judgment when it comes to this sort of thing. It's important to understand lifestyle factors whenever a diagnosis is made, and obviously the loss of a loved one would be a major psychological factor in any mental illness diagnosis. So when people complain about the loss of the bereavement exclusion, my question to them is, what is your better idea? Because I don't have a better idea for that. I think the removal of the bereavement exclusion is actually beneficial, because what it actually does is validate the fact that grief can take between 1 to 2 years. And I actually think that that's positive for people. I actually think that that's good on psychiatry's part, that they realize the influence of that particular factor in human psychology. And this type of negativity is being seen through all kinds of changes in the DSM. And while I don't think every change to the DSM is good, and there are certainly other changes to the DSM that I would have made, I think that overall, the psychiatrists who worked on the DSM did something that was extremely difficult, extremely challenging, and did so to the best of their ability and to the best of science's knowledge at this time. And I think that instead of saying these are the 10 worst changes and this is all wrong, I think that instead of doing that, what we need to do is take a step back just for a minute and look at the reason behind the change. Because it's not just the change that matters, it's the reason behind it. And if we understand that, then we can make better diagnoses moving forward. And that is the goal. My name is Natasha Tracy, and this is Breaking Bipolar.